Good afternoon. I want to welcome everyone to our Equity Task Force meeting today. I know we have a bunch of people in the process of logging on, so we'll give everyone just a minute or two to join and then we will get started. All right, let's go ahead and get started. We've got a full agenda today. I know we still have some folks that are in the process of joining us, but I want to welcome everyone. Nathan Fletcher, great honor being chair of the San Diego County Board of Supervisors, and I appreciate all of you. We started this group last year to talk about issues surrounding equity, in particular in the COVID response. And so our regional COVID equity task force, you all over the last year have driven policy decisions, directions, things we needed to do. You provided tremendous input and feedback, along with being great advocates out there to help implement a lot of the policies and programs you've called for us to do. Plus being a great sounding board to hold the COVID response accountable for the issues that are important. And so appreciate you all coming in to join us. We're going to kick it here in a minute to Nick Massion, our agency director, who's been heading up our T3 effort, which includes our vaccinations, to give you an update. Just quickly before we go to Nick, San Diego continues to lead the state of California in the number of vaccines administered per person. Obviously, there's been a lot of challenges surrounding vaccines. We have inconsistent supply. It is erratic. It is start-stop. We've also had logistical challenges. We have to use the My Turn system, and that system, despite for 9 weeks now saying we have to have the ability to block appointments by a zip code, still does not allow you to do that. And so in order to try and get it into the hardest hit communities, we found a lot of workarounds and a lot of things. We've got 8 different groups out there, community healthcare workers that are making appointments direct into the system, bypassing the My Turn process to try and get them dedicated appointments. We've got mobile teams out, both at senior complexes and hardest hit areas, out in the fields, vaccinating our farm workers. We've launched walk-up sites only for residents in certain zip codes at locations. 29 of our 30 vaccination locations are in zip codes that have been hardest hit, both case rate and HPI, a blending of those two. And we're going to continue to try and do better every single day. I just saw a report now that out of seniors, 71.5% of seniors in San Diego County have been vaccinated. Interestingly, in the breakdown by region, in our South region, it's 91.4% of seniors 65 and older have been vaccinated. And so some of those targeted efforts to reach those communities are beginning to pay off. And so I appreciate everyone's work as we go through there. Right now, we're still doing any seniors who haven't got it. We're also in the tier of education and childcare, food and ag, along with emergency responders. And then on the 15th, on March 15th, we'll be opening up to folks with underlying health conditions. and making that available. And again, we still hope that the supply and availability of vaccines will increase to meet the demand. But there's a measure of action that is happening and progress that is being made. And so I think we're all grateful for that and beginning to see a way out of this. With that, I'm going to kick it to Nick, who's going to talk about the vaccine equity rollout presentation and discussion. We'll talk about that. And then after we hear from Nick, we're going to come back and have a separate discussion about pathways to an equitable recovery. San Diego County is receiving federal funds, and you all help guide a lot of the investments about what those funds should be used for. We're going to get a presentation from our Assistant CAO, Michael Vu, around the federal stimulus funding, and then have the opportunity for you all to think a little bit about that. You don't have to decide today. We're going to be having a community forum on the 18th, March 18th, dedicated exclusively towards ideas around funding, but we want to socialize with you what will be available and get you thinking about it, and then come back on the 18th so we can do it. And then the last thing on the agenda, the fourth thing, will just be a general community discussion on COVID response. And I know Dr. Ramers is on. I know Christian Ramirez, we've been working on janitor vaccines this year. I know Mayor Salas has some thoughts. And so we're going to get through all of that. We're going to do it in an hour and a half and keep everyone on time. So with that, let me kick it over to our agency director, Nick Massion, someone I have spoken to every single day for 378 days, 7 days a week as we've worked through this response. So Nick, the floor is yours.
Thank you, Chair Fletcher. Let me put up the screen real quick. So you don't see it. You can all see the slides? Okay. You know, the chair mentioned this right from the get-go. It's great that we're leading the entire state, in terms of total number of vaccinations. It's important. Clear leader in Southern California, but it's more importantly also where we're doing the vaccination. So the chair mentioned we developed an ecosystem. This is a population health-based approach, and we're really from building off the T3 strategy that place matters. And so we spent a lot of time, and all of you on this call and many others were helping us as partners, telling us where we needed to be and how those services needed to be rendered, and what languages and what ways. And so we have mobile teams building with trusted messengers in fields to get the field workers. And then we have, drive-throughs and large urban areas and everything between and smaller pods. So there is no one size fits all because of the diversity of our community. So you could see the illustrations of these, of the different modalities we have. And many of you were part of this. I see the Mayor Salas. We've been partners with the city in testing, COVID testing, and then vaccinations at the Sears building, at the Superstation. The list really goes on, and that's the beauty of San Diego, is that we did this together in these modalities. I will call out, we are blessed to have a presence of military and veterans administration and sovereign Indian nations. And they have been also doing vaccinations, and they're not in our numbers. So our numbers actually would be higher, but they've been great partners, obviously, in our community. And then pharmacies, you'll see in a moment, play another key role. Initially, as they were helping us to get to 100% of our skilled nursing facilities, and now in the high 90%, fully vaccinated in the high 90% of our long-term care facilities, critical places where we needed to be. And so what we started in our county is we looked at not just the county map, we looked at the Healthy Places Index. Again, we built on the work that we were doing in T3, needing to be in the community. It's great that the state now really stepped up, focusing vaccinations in these zip code areas. We've been doing it for a year. And so we applaud that. And we applaud the state, obviously, pointing to San Diego and how we've been working hard and still improving where we put our sites. And you can see we have superstations, we have county sites throughout, and they overlay to where we need to be in our community. This next slide shows you, when we think about access, that it's also now pharmacies. And when you overlay our sites, the pharmacy sites, by the way, this does not have the hospitals who are also doing vaccinations, right, in some capacity, that we have a pretty vast network. And this did not happen by happen chance. We worked on this. We worked on with every single partner in developing these because they had to be done and stood up correctly. And again, with the premise from us, let the data be it, but let the community tell us how and where. And so we led with that and continue to lead with that approach. So partnerships. To us, this was no, from the Live Well San Diego approach with our 500 partners to dealing with a pandemic, partnerships are the way that really have guided the work we do in San Diego. And I can't underscore for everyone here and many, many others the value of that. We would not be able to really connect with the community were it not with our partners. There's some things we do well in county government, and there's many things we need our community, but coming together, we make a powerful team. And so this Project SAVE, which stands for Scheduling Assistance for Vaccination Equity, is something we take great pride in San Diego that we developed, and saying that we know, and the chair mentioned this, is that heck, my folks back east wouldn't know how to navigate a 211 system or clearly an online appointment system. They don't know the language, they don't know the elderly, they know how to navigate. And so these are our families, our neighbors, and we knew that for a number of our San Diegans, they would not have a way to have equal, fair equity and access to vaccination of even getting registered. And so our partners stood up and we said, we got to get to the community. We got to go to the community and find ways of really connecting with people. And so I really got to give a shout out to Chair, but our Vice Chair, Nora Vargas, who led the way in doing some work with our city partners in no appointment walk-up opportunities, working with our community partners in identifying folks. I know we did something with Northgate Gonzalez Market and all their grocery kind of staff. And they were telling us firsthand they would have not been able to get to the 700 appointments, vaccinations that we did a week ago, had we not done the work together with our community partners and them and streamlining the process. It's not cutting the line. It's just making it fair to people to be able to access it when it was their turn. So I just can't say enough about the amazing work our community partners have been doing in our outreach effort. And is an illustration of, another amazing partner is 211. We found early on the inability of our elderly not being able to be fast enough to get those available appointments. So the chair gave us an edict, find a way to make it fair for our elderly. And we went to 211 and Bill York and said, listen, we need to have a system where if people they can't make their way onto an appointment, can you help them? And in fact, they have. And they actually literally help them on the phone and schedule an appointment. We have now used that service, started with 75 and older, then we've gone 65 and older. They are now using that for people, our seniors homebound, creating a list of people and then trying to give it to vaccinators who can get to people's homes. 211 has been, a really key partner on that. And then I mentioned already about these piloting of no vaccination sites. Let me give you an inside secret. We know at some point with the trusted sites that we have, just like we did in testing, we're at some point going to move to just getting rid of appointments. We can't do that right now because we have to do an orderly way of getting to folks who need it the most. And I think, and I applaud both CDC and CDPH and the state in doing that approach. But at some point soon, we're going to then, and we're doing that already at our Border View YMCA, been testing no appointments, it's walk-ups. And it's working, and we're expanding that. And why did we start in South Bay? Well, obviously the prevalence of where we need to be in South, just like our testing sites, our vac sites. But we also have needs in Escondido and El Cajon and Oceanside. And so we're taking this model and expanding it to our sites. And it's the county pods because we can manage that, but we're looking to do that in our other sites. Again, breaking down the barriers to make it more fair and accessible to people who struggle and getting those appointments. In doing so, we have to connect. And so we're really running dual tracks, right? Helping people right now who are ready to get the vaccinations. but we're also dealing with people who are hesitant or maybe unsure. And we know that exists in healthcare as it exists in the general population. So we're not waiting till we get to the end to deal with those. We've been promoting that now. And again, through your efforts and some of the marketing efforts we've been doing, connecting to all communities. But I want to show you this more recent one, a radio spot, and you can kind of see it's going really broad. And again, a great effort through our vice chair and our chair's leadership on the subcommittee in promoting this. But I want to just share this kind of short video clip to show you what's airing. And hopefully many of you have heard it. And if not, please help us push it out. We're happy to get it to you. So let's hear it for a moment.
Cuando sea su turno, vacúnese contra el COVID-19 para protegerse a usted y a su familia. Conozca más detalles en coronavirus-sd.com/vacuna. Regresemos a pasar tiempo con nuestros seres queridos.
When it's your turn, get a free vaccine to protect you and your family from COVID-19. Let's get back to the things we love.
Learn the facts at coronavirus-sd.com/vaccine.
Clearly, San Ysidro Health Center, the Black nurses, are two of the many partners we have. We have Latino Health Coalition, the Multicultural Health Foundation. This is our good friend and leader, Dr. Hood, you see here. We have had many partners, right, with our Filipino Association, working with our refugee and newcomers. We're looking and broadening our efforts and the reach and focusing primarily right now in the Spanish, and then targeting it also in the health equity quartile areas. Again, trying to be smart of where we're trying to make those connections to communities so they're aware of free vaccinations near them and the importance of getting vaccinated for themselves and their families. We're doing print medias. We're doing, live radio, TV. We're printing materials and getting them out with all our different communication, live well sectors. Many of you have been doing other related materials in the same way. This is a collective effort with a collective impact, right, of trying to get better than 70% of our eligible population vaccinated. We're not shooting for 70%. We want more. I know Dr. Ramers is on and Dr. Wooten, they'd say, hey, let's go for 100%, right? But that's where we're going. And we're not going to stop just because we hit 70%. We got to continue to make sure we vaccinate everyone possible that has the heartfelt need to take that vaccine. So, been mentioned already by the chair where we're at currently. Starting Monday, very exciting, we're going to go to a big group. And that is individuals with some qualifying underlying health conditions. This is big. This is a big group. Now, some of them, over 500,000, some of them are already elderly and hopefully got vaccinated, but we know there's still a number of people with health conditions, not elderly, that need to get vaccinated. And so probably in the next hour on our county website, we will have, and it's been mentioned by Dr. Wooten, really a very nice instructions in terms of who qualifies, right, the conditions. But I will tell you, I got a lot about how are you going to prove people the proof, and some people don't have the documentations, et cetera. So in working with Dr. Wooten, our public health officer, we believe in our public, and our chair said this. We have honest people here, and so we're going to ask people to confirm that they have an eligible health condition meeting the criteria, and they meet it. And we go on and we vaccinate. So we're going to try to reduce those barriers as best as we can. We know not everyone's going to have documentation. Some people will, some people won't. People say they have a health condition. We believe in our county, and we're going to vaccinate. The reality is we're going to have to vaccinate everyone we can. But I think we're going to get the majority of the people that we need to get to in this group. And, we still have a long way to go. We're leading in the state. That's great. 1 out of 4 San Diegans already, 1 out of 4 eligible San Diegans have been vaccinated. And the good doctors tell me that within a couple of weeks, there's already, some protection already. They have to get that second shot, right? Unless they got the Johnson, J&J. And you can see we're pushing 15%, 14.4 to be exact. Tomorrow will be 15 of fully vaccinated. And, you know, we only got 14,300 of the Janssen J&J vaccine this week, and we'll get some hopefully in the coming weeks. But that's a game changer, right, in that vaccine. And I'll pause and just end by saying I really appreciate, because a number of you also from our county COVID-19 Clinical Advisory Committee, and your work has been invaluable. It's been fantastic. You've been helping us even think about, you know, thinking of the groups that we use, for example, the Janssen vaccine for. And I know Dr. Wooten has appreciated, as I have, and my team on that. But we're measuring as we go along, but again, ending by saying it's numbers, but the numbers behind it of how we're doing it, where we're doing it, how we're making sure people are being linked to medical homes. We're not going to lose the opportunity while we're connecting with people of not also cross-messaging the importance of their own personal health in addition to combating COVID. So, Chair, that concludes my update. I'm happy to take any questions or feedback.
Yeah, thank you. Thank you, Nick. Let's go, we'll go quick. We want to stay on point, but let's open it up. If you have any questions, if you just raise your little digital paw, we will call on you and go on any questions. I know there's a lot of questions probably around vaccines, but if we can knock out a few here and then we'll get to our next topic. I am looking to see if anyone has any questions. I see Mayor Salas. I've spent like my entire day. This is my third Zoom with Mayor Salas. I'm on like hour 7.5 of like consecutive Zooming. I don't see anyone. All right. Well, if you have questions, we can get to them. We'll get to them at the end. We can certainly come back in a discussion point, but thank you, Nick. And thank you for everyone on this call. I think so many of you have been involved on an almost daily basis with everything that's going on, the struggles that we've had, and how we've worked really hard to try and address them and make the situation better. So next we're gonna transition. Thank you, Nick. Good job to you and your team. To a discussion about pathway to kind of the equitable recovery. You know, you all know we talked about more than a year ago when we formed this group, how we want to make sure we're guiding our response through an equity lens. And now we're at a place where I think we need to guide our recovery through an equity lens. We're certainly not out of COVID. We're still aware it's present. People are still losing their lives, but we are in a very different situation now than we were in January and February. We have the presence of the vaccine, case rates are coming down, and we're beginning the recovery process. But an important decision coming up by the Board of Supervisors is going to be the allocation of the federal funds that come in. We think the county will receive a little bit over $600 million. Now, we've got some bills we got to pay. This whole vaccine network of sites and stations, and we've administered more like that. It's been expensive. And so we got to pay the public health cost. We got to continue to cover a lot of the public health costs surrounding testing and other things. But there will be some funds left over to be invested strategically. And I think trying to assess what is the federal money doing, what is the state money doing, and what are gaps where we can step in and fill a gap and make a difference will be important. And you all helped guide and shape that first go around. And so I want to ask Michael Vu. You all know Mr. Vu is the wonderfully calm and registrar of voters who guided us through elections and managed the complexities of, I think one election he had like 27 million different variations of the ballot. And maybe not quite that many, but it was a lot. He's now come into the role as our Assistant Chief Administrative Officer and is doing a great job, and we appreciate him. And so I think Mr. Vu is here to walk us through a presentation on the federal stimulus funding, and then just want to socialize that with all of you, get you thinking about types of things that we may want to consider funding. And you can throw some of those ideas out here, but again, we'll be having a community forum on March 18th, specifically designed to get ideas that can be worked into the plan before it goes to the Board of Supervisors for approval. So let me kick it to Mr. Vu.
Chair Fletcher, thank you so much for the introductions. And yes, my prior capacity, there was a lot of complexities in conducting any type of elections, let alone last year's election. And now in my new role, it's much more complex and on so many different levels, on so many different topics at any given day, but particularly as we are doing everything that we can to keep the public safe and healthy, and certainly doing our part in as Nick had presented, getting individuals vaccinated within our community. So let me, as he's doing the legwork and getting vaccination shots in arms, let me kind of give the lay of the land in terms of where we're at from a funding source component, particularly after President Biden signed the $1.9 trillion American Rescue Plan that was just signed into law today. Let me just start by saying that I've got a presentation that I want to share, and I'm going to do so right now. And let me see if you can all see that. Yep. Okay. Well, as many of you know, a big component of the $1.9 trillion from the American Rescue Plan allocated a large sum of monies to states, local governments, tribes, as well as territories that are out there, to the tune of $350 billion that was allocated for all of those respective government entities and territories, as well as tribes. I want to really focus in on one aspect of that, which is the local government component of that. Of the $350 billion, $130.1 billion was allocated to cities and counties. I should mention, for the very first time, particularly for San Diego, and I'll get to that here in just a second, for the very first time, every single city is going to get a portion of those funds, of the $130.1 billion. In fact, for how it was broken down, of the 130.1, it was pretty much down the middle, 65.1 billion for cities, $65.1 billion for counties. How much is our portion of that going to come to the region for San Diego County? Well, as I mentioned, a large sum is going to be coming to the county, but also a large sum is going to go to each and every single one of the cities, to the tune of $1.26 billion coming to the region in terms of doing everything in combating that. And so let me kind of give you a breakdown of those respective numbers and how that is going to be allocated. Approximately $611.6 million is going to go to cities. There's a breakdown of how much is going to go to each respective city. And generally it was done by a population. And the other portion of that over $1 billion, that nearly $1.25 billion, $647.5 million is going to go to the county of San Diego. So I want to go to really the next slide here as to how that is going to be broken down, at least to how it was some of the guidelines that we've received. I call it 50% now, 50% later, right? So although there is 600 and some odd million dollars, whether it's to the cities or whether it's to the county, it's not that we're going to get all of the over $600 million in those respective areas all at one time. And as you can see here, the breakdown is you can get 50% within 60 days of enactment, and then the other 50% 12 months after the first payment is made to the respective jurisdiction or count, in this case, the county. So if you are a city, you're going to get $305.8 million. I know that Mayor Gloria did his press conference over the city's portion of this, which is nearly $306 million the city of San Diego is getting. And then there's a breakdown for all the other respective cities that are out there. But as you can see here, is that we're not going to get everything all at one time. And I think that's really important, as I will describe here in a second. I think it's really worth noting, though, is that before, when we received the first stimulus funds, we had a time period of using up all those respective funds. That deadline was December 30th of 2020. And for this go around, that's not the case. The way they have written the law is that the eligible expenses will go through December 31st of 2024. So it gives us much more time to be really thoughtful and methodical about what the impact is to the region as it relates to COVID, whether it's economic impacts, whether or not it's dealing with specific issues like homelessness, for perhaps, or rental assistance, and where people are economically, and to be able to revive the overall economy and where people are situated as a result of the impact that the pandemic has made. Let me kind of get into this. What are the respective uses of the American Rescue Plan? Well, as it's spelled out here, as you can see, is of course, number one, I think it's fundamental to everything that we're doing currently to keep everyone safe, and that is to respond to it by getting the vaccination, to doing testing, to doing tracing, and to keep everyone safe in that regard, to ensure that there's a sufficient PPE that is out there, ensuring that we have a good hospitalization that is out there. But other aspects of this, as we knew from the very first stimulus, is economic impacts as well. Small businesses, nonprofits, and other categories that needs to be propped up to keep the economy going. A big component that has been impacted are governments, whether it's local, whether it's the state, and that is the reduction in revenue, lost revenue, whether that's tourism, the hospitality businesses, taxes that are out there. Those are aspects that the federal government took into account of the $1.9 trillion. And that was a big component of what was being advocated from state and local governments that were out there. The other component is investment in specific areas of infrastructure. They really called out three specific areas, and that includes water, sewer, and broadband. And certainly broadband was a big component for during the first rounds, as everyone was moving towards teleworking or telecommuting, or kids going to school and doing it from home, and making sure that sufficient internet access or remote access was there for us to continue, whether it was education or whether it was vital services as we were all trying to shelter from home. And then lastly, what was called out, and this is not necessarily a complete picture of all of it. We're still going to be waiting for the guidelines, and I think that's going to be give us a lot more details. And as you all know, is the devil will be in the details as to where all these monies can be spent. But the other category also that was called out was premium pay for essential workers, premium pay for government essential workers. Essentially, what it called out was $13 per hour on top of the base salary that's out there. So that's another consideration that the monies could be used for if you are a city or the county itself. Okay, so I want to kind of map out really quickly what have we used the monies for in the past? Well, or currently. We've used it for vaccination, testing, tracing, treating. I'm sure Nick has spoken with you about all the kind of the status of those respective area. As I mentioned before, county response, and what we mean by county response is the issues associated with making sure that we have personal protective equipment that's out there, and hospital needs that are out there, public safety, teleworking infrastructure, outreach, sanitation, compliance efforts. All of those are under this category of county response that we've used the funds. There was $1,000 income stipend for those individuals that had tested positive for COVID, that we gave a one-time $1,000 payment for those respective individuals. Great Plates Delivered and Great Plates Delivered 2.0 were for individuals that needed food assistance, particularly those 65 plus and older. And that has been where it's partnering up with the various restaurants out there to provide, in the Great Plates Delivered scenario, 3 meals a day to those that are most vulnerable, that are in our senior population. Great Plates 2 is a version of that respective area. Food banks, again, whether it's with the food banks itself or the Feeding San Diego, the Jacobs Cushman San Diego Food Bank, or Feeding San Diego that's out there. Certainly, we already talked about the business stimulus that we allocated specific funds to the tune of around $9.5 million per district that we used for the CARES Act. That is supervisorial districts. Rental assistance, we had one round of that. We're actually in a second round, and I'll talk with you about that in a second or two. Things like childcare for essential workers, child welfare services, and behavioral health. Certainly you're hearing that in the news quite a bit, maybe are even impacted yourself, associated with maybe your kids or individuals needing to be at home, and how that is affecting their the health portion of it. And so we provided funds associated with that, or the board provided funds associated with that. And then what we did with the very first CARES Act money, the city of San Diego received their set of funds during that, but the other 17 cities did not. Well, the county was the individual, the jurisdiction that dispensed funds to those other 17 cities during that first round. And as I mentioned, again, this go around, the cities will receive their own fair share of the over $130 billion that is out there. And then again, I'll just reinforce the remote learning internet access and ensuring that where $2 million was funded by the Board of Supervisors for that. So the question becomes, that's what we did before, that's what we're currently doing, but all the monies were spent after that December 30th timeframe for the CARES Act. And so, but we had to continue programs and services that are out there. So the board was very intent on ensuring that certain services had to be and continue to be provided that were fundamental to services for folks that are out there. What are those? Well, they're vaccination, test, trace, treat, county response, again, the emergency income stipends, and the Great Plates delivered. These are all areas where the board had said, we need to continue these services. Certainly, we need to continue the T3 as well as vaccinations and the county response. That was just fundamental to the overall progress. So we've been using county funds for the past several months to fund these to the tune of approximately $12 million per week. Again, let me just repeat that, $12 million per week on these programs coming out of county resources to fund these. So when we think about the dollars itself and what we're receiving during the first tranche or the second tranche, we've got to be recognizing that how do we approach those respective funds of, if you will, recouping some of those costs to replenish what has been spent by through county funds. So we don't know what that picture is going to look like because we don't know how long this is going to take. We don't know how long Nick and his respective team, the county as a whole, the state as a whole, the country as a whole. As you have heard, Chair Fletcher, one of the biggest issues that is out there is vaccine. And the timing of vaccine is really important in getting shots into arms, and when are we going to be able to get them in such plentiful amounts that things can get to some degree of normalization. But when is that? We don't know. And that's a big question mark of how we are approaching, trying to frame out how these monies should be spent and how much longer of that $12 million per week is going to go through the remaining part of this year. And does it bleed into potentially next year? What does that look like? What does it look like from an unemployment perspective, business economic perspective? And so we've got to be cognizant, and the board has to be mindful of those things as we are looking at it and try to provide our thoughts around this area. But I wanted to kind of turn the attention to other funds of monies besides those that I have talked with you about under the American Rescue Plans, because we have other monies that we've received, as well as the city of San Diego has received. So one of those areas is the Emergency Rental Assistance Program. As I mentioned before, we received the first go around emergency rental assistance monies that individuals have been able to apply for. That first tranche of funds during the CARES Act, for the most part, has been spent. Now we have received over 107 million, at least for the County of San Diego, as well as for the 16 cities that are not listed here, for individuals who are vulnerable, at risk, and are in the arrears of their rental payment, to apply for $107 million worth of various funds, whether it's from the state or whether it's from the federal government. And so we're in the midst of doing that. Let me just kind of tee the conversations around that. The last number that I saw was over 13,000 applications have come in from various individuals. And we are fiercely going through all of those respective applications, determining whether or not they are applications from the 16 cities or the unincorporated area, or are they really from the city of San Diego or the city of Chula Vista. The city of San Diego and city of Chula Vista, they receive their own funds based off of population. The criteria was, if you had a population over 200,000, you were able to get your own respective funds that are out there. And so the city of San Diego, as well as city of Chula Vista, are standing up their own respective program. And we're in alignment associated with how to approach that. We've got our own landing page for individuals to determine whether or not they're part of the city of San Diego, part of the county and the other 16 cities, or in the city of Chula Vista. So it is more of a streamlined process, as efficient as possible for them to get the services that they need and to apply for these respective dollars. The other area that I wanted to mention is the second stimulus funds that were passed in December. As many of you called, that was HR 133. Again, that was specific to, again, combating the pandemic and making sure that we could continue vaccinations and testing. Our portion of that amount is $123.8 million that the county has received. And again, that will be focused in specific areas based off of the guidelines. It's not like we have free reign on all of these respective dollars. We are really filtering in on what they can be applied for. As you can imagine, I'm sure that there's going to be a lot of auditing going on when these monies are going to be spent at the end of the day and how we use these respective dollars. So we've got to be very cognizant of that. And in this specific case, there are specific criteria as to the lab testing, vaccinations, and the containment of the virus is what these funds are to be used for. That is in a nutshell where we are at and where the American Rescue Plan is at. Big dollars are coming at the most opportune times. I think if you're looking at from my perspective, this provides a lot of opportunities, not only just a lot of opportunities related to the pandemic and getting past the pandemic, but also seeing and addressing issues that may have existed even prior to the pandemic. And that's where certainly everyone's putting their best foot forward, trying to do their due diligence and looking to the future post-COVID and ensuring that we have a vibrant county as well as various local governments are made whole. So with that being said, I will turn the time back to the chair for any potential questions and answering that I may have, as I have been soaking in everything about the county, everything about the pandemic other than elections.
Thank you, Michael. Let's open it up here. Let's see if there's any questions about the American Rescue Plan and the funds that are coming here. And again, you ought to be advocating for priorities, not just with the county, but with every city. As Michael talked about, every city is going to be making decisions about what they're going to do with their funds. And so would encourage you to, as you think about the priorities you want to push us to use that same action with other cities. So let's open it up here, see if we have any questions or comments from anyone on the line.
Hello, this is Joanne Fields from the Asian Pacific Islander Initiative, and thank you for sharing this report with all of us. I received an email from South Bay Community Services regarding the rental and utility assistance in the city of Chula Vista. I noticed that there isn't an organization that is strong in reaching out to the Filipino and API community in the city. How did the bid go out for these outreach contracts? Is it something that was started in the beginning in March? Is there room to add additional organizations? Because I know that there is a big push for equity, and I'm just trying to make sure it's equal for all communities. So is there room to add?
Question about the city of Chula Vista?
Yes, and I know.
Okay. Well, let's ask Mayor Salas if she wants to address that.
I thank you very much, and this is a wonderful discussion. So the city of Chula Vista reserved a certain amount of money that we're actually handling through the city. I think it's about $5 million that we're handling to directly give out funds through our housing department. But then the other of it went to South Bay Community Services. We had to make a selection on the capacity of an organization to get the job done, because you have a time certain to do it. And so we had to, look towards those organizations that we knew had a track record. Now, if Miss Fields has any other organizations that she feels would qualify to get the money out on time and to the right people, we want to know.
Well, thank you, Mayor Salas. We did have a contract for the census, and we did execute that well. So I did send out an email to Angelica because right after I received the email, so I will follow up with her. But thank you for your answer.
Okay, thank you.
Great, thank you both. Any other questions for Michael around American Recovery and Response? Again, really encourage folks, think about priorities, programs, creative things, and we will share with you all the information on the community forum we're having on March 18th. That's dedicated exclusively to this topic and really getting community input on what you think the County of San Diego ought to do with the funds that it receives.
Chair, can I add one more component, just a pitch?
Of
Let me
course.
just say that we are trying to get community input in this respective area of how these monies should be used, and the prioritization of these respective funds. Is actually the board had decided at the last meeting what that framework would look like, and encouraged us and recommended to our CAO to do outreach in this respective area. So we've actually have 5 workshops that are going to be conducted next week on March 15th. 2 of them, March 18th, 2 of them, and then March 19th, 1 of them, 1 for each of the respective districts. Flyers are out depending on what districts that there are. So I encourage you to participate in that. We'd like to get feedback as to the priorities of these dollars, as you saw from the slide deck that I showed, some of the respective areas. But if there are potentially blind spots, some of the other programs that are out there that we may not know about, that we should be considering, the board should be considering, we want to make sure that we're synthesizing all of that, distilling it. That way we are thoughtful in our response back to the board when we actually receive those respective funds. So keep an eye out for those respective flyers and participate within your respective district. Thank you so much, Chair.
Thank you. All right. Any other comments, questions, thoughts? Or shy group today? All right. Thank you, Michael. Great presentation. And I look forward to seeing you on the 18th as we sort through all of this. You're welcome to stick around. You don't have to leave, but thank you for the great presentation and all your work. It's great to see you in the new role. We're going to move to our last agenda item here. It's just kind of a community discussion on COVID-19 response in general. Just an opportunity to talk about various things that are going, what's working, what's not working, how can we learn from one another and kind of hear what's happening. And so I think to kick this off, I think Mayor Salas has some thoughts, Dr. Ramers, we got a few folks keyed up. And so this really just should be an open discussion about what are you seeing out there and where do we need to do better or share with each other. So Mayor Salas, let me kick it to you.
Okay, thank you very much, Nathan. And, thank you so much for the county for convening this. And as we all know, COVID, at least for me as a mayor, has been the best of times and the worst of times. And I think that the best of times is exactly what Nick was talking about, is partnership, 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 and the strength that we've had as a community to fight this COVID in a manner that has been so united. And so not only is our partnership with the county, but I've been working very closely with our South Bay mayors, Mayor Alejandra Sotelo Solis, Mayor Serge Dedina, and Councilwoman Moreno on really working with our county supervisors. And this has been an opportunity for us to have this interaction with our county board of supervisors like never before, and getting to know some of the great staff that's there as well. So as you know, the city of Chula Vista, we started to operate our emergency operations center right when we found out about COVID. We actually activated it towards the middle of February because we saw what was coming, and we rapidly really reassessed the work of our staff and where we were going to deploy them. So one of the awesome things that happened is that we formed a partnership with the county, and we began to offer our employees and established a call center in our library in order to help assist with the 211 calls. So we are averaging about 1,200 calls a week in our center, and let's see, we've had a total of more than 10,000 calls that have come through the 211 system through Chula Vista. We have bilingual operators on board all the time, and we're open from 11 a.m. to 7 a.m. to man that, to personnel it. So anyway, and then again, you know, we have also used our city staff to help people sign up for the vaccine. So we established, in addition to the 211 line, we established our own number for our community to be able to call in, again, bilingual, with any problem that they had with scheduling an appointment, and we had staff to actually navigate and do it for them. So that's another great partnership that we were able to do. Sharp, again, they reached out to my office and said they needed to identify a site for the vaccination. And so we had a perfect site, you know, that's really close to transit, easy to get to off the freeway, and bus lines and all of that. And that's the old Sears Center that was already being used as a COVID testing site. But now we've done on the north side of the building, and now on the south side, that's where we have walk-in appointments, or excuse me, appointments where people can actually come in the building. It's not a drive-through. They come into the building. They're assisted by volunteers from all over. I mean, the volunteers in our community have been phenomenal. And so with Sharp, with the county, with the city staff, all working together, also the volunteers, were able to vaccinate at our super site, and it's gone very, very smoothly. I got my own 2 shots there, and it was a very pleasant experience. I drive by every so often now with the new categories of people that have been allowed to get their vaccine. Of course, the site is a little bit more crowded than it was before. Again, our staff is assisting with on-site registrations. And then our latest partnership with the county is actually working with our fire department. So we have 27 firefighters that are trained paramedics on our new ambulances that have been outfitted. And we actually go to individual homes where people cannot get out of their homes to get vaccinated. We go to senior centers. We go to low-income apartments. We go to the trailer parks. And to date, since we've started that program with our firefighters actually delivering the vaccines, putting them in the arms of people, we've vaccinated, our fire department has vaccinated over 5,000 people. That's just remarkable. So we focused, you know, that program with our firefighters basically on the elderly population and those that can't get out of their homes. So, and then once again, I just have to say that I have never had such a wonderful working relationship with county staff. Nick, you've been the bomb. With county staff and with the supervisors and with the Sharp Hospital people and the city employees that have done so much to shift their workloads, be creative, think out of the box. You know, we've utilized our staff to do things like operate a food bank from our libraries. We've done them to actually deliver food to people to their door that couldn't get out to get it. So again, you know, going back to my first comments about the best of times and the worst of times, I think the worst of times is that we can't all be together, that we can't be with our families. But you know what? adhering to those health mandates, it's really working now because we're seeing the numbers go down. And even though we're vaccinating, we can't let the guard down. We have to continue to use the mask, do social distancing, and keep our circles of social contacts small until we get even further down the line. But again, yeah, it's the worst of times, the best of times. It's brought out the best of people and sometimes the worst of people. So that's what I have to report for what we've been doing in the city of Chula Vista.
Thank you, Mary, and thank you for all your work. You're right. It's been a very difficult year, incredibly challenging for sure. And the conflict and division gets a lot of the attention, but every day, I think we're fortunate to be in a position where we see the best of people, where people are coming together. They're figuring out how to make things work. They're putting the pieces together. And it's challenging with federal rules and state rules, all of the other types of things. But I do think that there has been so many people that have rallied together to support each other and help each other. And so many great examples like what you've done in Chula Vista, where partnerships have come together and happened in ways that they never have before to respond. And so I think all that really is encouraging. So thank you for all your work and for that great update. Let's go to Dr. Ramers.
Thank you, Nathan. I'll pile on with the Love Fest here. It's been really amazing that you have even convened this group and that there's such eyeballs on the equity issue, which, from talking to other jurisdictions around the country, there's really not. So thank you for that. And it's really amazing, like Mayor Salas said, just to have this forum, even to be able to speak frankly and speak truth to each other. So Paola asked me to kind of present on behalf of the Clinical Advisory Committee. And so I'm speaking really on behalf of Dr. Nettie Aldis and Dr. Rodney Hood and that group. And there are also, there actually are 3 equity committees in San Diego now. There's this committee, there's the Multicultural Health Foundation and Rodney Hood's group that has an equity committee. And there's actually even a subcommittee of the COVID-19 Vaccine Clinical Advisory Committee. So I'm really speaking on behalf of many people. I thought it would be useful, since we throw the word equity around so much, to just use this little graphic, because this becomes a very practical thing to think about when we are faced with decisions like vaccine limitations and that type of thing. And the idea here is just that if we just treat everybody equal, it might not be fair for those that are disadvantaged in one way or another. And you see this in the graphic on the left, where someone who is vertically challenged and can't see over the fence, and the fence is of course a metaphor for structural barriers that we face in society. If we just give 10% of our vaccine to everybody, it's really not going to be fair to the people that have been disadvantaged. And especially when you look at the numbers of people that have had disproportionate COVID cases, hospitalizations, and deaths. And whenever we use the word equity, we should be using it appropriately. And that means giving people the support that they need. If they're coming from a place of disadvantage, giving them extra support. And I think after Michael Vu's presentation, this is how we should be thinking about an equitable way to distribute money or distribute tests or monoclonal antibodies or vaccines. You really need to go the extra mile for the people that are the most disadvantaged while the barriers are still in place. Of course, the ultimate goal is called justice, or some people call it liberation on the far right, where there are no more barriers, but that's kind of a utopia that we certainly are not living in now. So with that in mind, I wanted to talk about vaccine equity in San Diego, and I want to lead with a quote that is from F. Scott Fitzgerald, who said that the test of a first-rate intelligence is the ability to hold 2 opposing ideas in the mind at the same time and still have the ability to function. And the reason I bring that up is because I'm going to, at the same time, say that we're doing incredibly well with vaccination. You've seen that. We're leading the state. We've done over 1 million vaccinations. And I'm also going to say that we can do so much better. I'm going to say that we are seeing in some populations clinically on the front lines, almost elimination of COVID-19 in certain populations. I haven't seen somebody over 65 with COVID-19 in months, actually. And that's a testament to the success of our vaccination programs, but I'm also still seeing people die. So great success, but still something to do. And then to apply it to this discussion, we've seen such an impressive number of people vaccinated, and we're rolling out like crazy, but we're also seeing some stark disparities in vaccine equity. So going back to the very beginning, when the National Academy of Sciences first attempted to create a framework where we could actually equitably distribute this precious resource, this is what they came up with. I was lucky to contribute to this discussion a little bit. And you can see on the bottom that equity should have been a cross-cutting consideration across the board from every single phase and tier that we do, that in each population group, vaccine access should be prioritized for geographic areas identified through either the Social Vulnerability Index or another more specific index, such as the Healthy Places Index. And a lot of these tiers and a lot of these groups that were included in here, such as at phase 2, the second bullet, critical workers, essential workers, were literally placed where they were placed because of structural racism. And the people that convened this committee said we didn't really want to make race in and of itself a priority. We wanted to make racism threaded through all of this. And that's why they chose all these different groups. It's been a little disheartening to see some of these groups just sort of disappear as the iterations change and change and change, with CDC and state, CDPH kind of getting their hands in this. But suffice to say, it's been incredible. You've already seen this graph, 25% of the population getting at least one dose of vaccine. And we are seeing the result of this with lower cases. I truly believe that when you combine 25% plus, who knows, another 25% that have already had COVID in the county, we are reaching the effects of herd immunity. And herd immunity is not an on-off switch, it's a dimmer switch. So we're starting to see less cases because the virus simply just has less people to infect. But you look on this chart also and you see that 17% of the vaccines that have gone into arms have gone into Latino arms. And that's just not enough when we look at other numbers in terms of case rates and death rates, which are more like 50% of the population or 44% of the deaths in Latinx community. Alicia Riley, who's on this call and who was the co-chair of the data subcommittee, looked at some of the early published data on zip code vaccination rates in green on this heat map, and then case rates in red. And there are all kinds of caveats here. I know Nathan and I have already discussed this kind of issue because we are bound by the phases, and we had to do people above age 65 and healthcare workers first, and that's what this probably reflects more than anything. But there's also some pretty stark findings from this early analysis. And the first one is that the top 3 zip codes are Coronado, Del Mar, and La Jolla. And then you see the harder hit zip codes down there, San Ysidro, Chula Vista, and El Cajon, which I just highlighted, have just very different ratios of COVID case rates to COVID vaccine rates. And in particular, you see all of these sort of hotspots in the vaccine chart here, mostly in the North Coastal area, in the North County, La Jolla, and Coronado. And those really weren't spots where a lot of COVID existed. So I think it's an interesting baseline to look at. And boy, we better continue to do better as the vaccine rolls out. Speaking of the CDC Social Vulnerability Index, we have these numbers. This is maintained by the county. We know where the less healthy neighborhoods are. Of course, a lot of rural areas there in the North County and the East County there. But when you zero in on downtown, it's really the I-5 corridor down to Chula Vista, San Ysidro, and then over to the east to El Cajon. And kudos to the county for now overlaying vaccine receipt rates with these health equity Healthy Places indices. And it's a little hard to read, but you basically do see a whole lot of white, which means lower vaccination rates in these areas. I just want to finish with a sort of a final point, which, and I'm really speaking on behalf of Dr. Aldis and San Ysidro and other partners from neighborhood health and health center partners here, which is to just emphasize how federally qualified health centers can help solve this problem. This is the dashboard for family health centers vaccines that we've developed. It looks a little different than the county one, but out of 20,000 vaccines that we've given, more than half of them have been to quote unquote new patients who are not our patients. They're people we're serving in the community. 73% in non-white individuals, 46% in Latinx community, 5.6% in African-American, and 93% either in the central, south, or east in exactly those regions that are the lowest health equity indices. Likewise, San Ysidro, it's a little unfair comparison because this is from a couple of days ago, but of the 13,000 doses they've administered, 68% of them from the Latinx community and 3.3% African-American. And so I'll just finish with this slide here, which is why does this look so different than the broader effort in the county? Well, it's because our patient populations are just de facto enriched in this lowest equity quartile population. We have several-fold higher percentages of Latinx and African-American populations. A large majority of our patients are below the federal poverty limit, which automatically places them into these low health equity indices. I was just a little distracted from Mary Salas's dog in the and many of our patients are uninsured. Our locations, our clinics, which are now doubling as high volume vaccine centers, have been intentionally located by the federal government in these neighborhoods. And they are the ones hardest hit by the COVID-19 pandemic. Many of our staff live in the same neighborhoods, so staff vaccines favor equity as well. And we've been here for 50 years earning trust, so we don't really have to come up with a new marketing campaign to earn trust. The scheduling and the practicality of this is also a very key thing that many patients don't really know how to use My Turn. And I think, Nathan, you've discussed that as well. We can just schedule people the same way we schedule them for all of their regular primary care visits, and that's a critical way. And then we have existing systems to kind of contact people that really work for them. So I could go on and on and on about how the Blue Shield transition really concerns us and worries us. But I just think I wanted to sort of present that in terms of vaccine equity. And when you think about where, if you want to push vaccine, where it should go in an equitable way, why it really makes sense to those of us on all these different equity committees to use our community health center infrastructure. So thank you for the time, Nathan.
Thank you, Dr. Ramers, and thank you again for all of your work. It has been, I mean, My Turn's been frustrating. At the outset, I said we need the ability to restrict appointments based on zip code. And that functionality still 8-9 weeks after the request is not there, and that's been a challenge. And you know, you're right. We had to do healthcare workers first, and the demographics of healthcare workers do not match the demographics of the county as a whole, and the demographics of county as a whole do not match the demographics of case rates. And then we went into seniors, and again, that doesn't match the case rate. And if the early strategy had been vaccinate to slow the spread based on cases, and we'd had that ability, the numbers might look different. But it's still been a challenging situation to try and address and work through. And I appreciate all the work you all are doing. And Christian, I think it was a year ago when you texted me like, we don't have any masks, and like we were hustling to get masks. And it's you've been with us all the way through this, and I really appreciate all of your work. Let me ask, is Christian Ramirez on with us? I think Christian.
I am, Chair.
Yeah. So Christian Ramirez and Christian Ramers, I text you each. Like half the time I try to text one of you, it goes to the other one. I just type Christian R in my phone, and so Christian Ramirez always gets random texts that seem like they're meant for a doctor, and Christian Ramers sometimes get random ones that are meant for. So anyway, it's your random thought of the day. I don't know how many times I've said, nope, wrong person, sorry, and then I got to text the other one. So good to see you, Christian Ramirez. Appreciate you joining us. The floor is yours.
Thank you so much, Chair Fletcher. I just wanted to commend your leadership, Chair, for fighting very hard to ensure that essential workers are given an opportunity to get vaccinated. It's been, I'll be very honest, it's been a very difficult process with the state of California. You know, we've all agreed that janitors and airport workers and security officers were essential nearly a year ago when we entered this terrible pandemic. They have been essential through the pandemic, and sadly, we have the body count to prove how difficult it has been for essential workers in this past 12 months. It seems like 12 years. But finally, we were able to ensure that essential workers who are janitors, who are security officers, who are airport workers, who live precisely in the communities that Dr. Raymer was just highlighted, get finally the vaccine. And it's been difficult, but I'm pleased to inform that thanks to the leadership of the chair and the vice chair and the task force, we have the first dedicated vaccination drive to janitors. It's going to be this Saturday at Mar Vista High School. And it's a pilot program. We have several hundred more janitors to go. But we will take this first step in the right direction. And I think that what's important to note is that, as folks may know, it's difficult to make ends meet in San Diego County, and it's nearly impossible for a janitor to make ends meet in San Diego County. So many of our members, in order to compensate their income, have to work in the informal economy. And those are the other folks that we need to start thinking about. They are also essential workers. They don't have a letter to prove it. They get paid cash most of the time, but they are risking their lives, and many of them are dying. So we're working to ensure that we get the word out. And what we've noticed And we just did this vaccination drive up in Sacramento today. We administered about 500. We were part of a process in which 500 of our members were administered the Johnson & Johnson vaccine in the city of Sacramento earlier today. And what works, and we know this works, is when a worker sees another worker get vaccinated in their community by trusted medical personnel, that gets the word out. And our lines have been inundated today. That's why I'm a little bit late today, because we just have literally thousands of our members calling who were unsure about the vaccine yesterday. Now that they see their colleagues getting vaccinated, they want the vaccine now. And that's exactly what we plan to do in Imperial Beach this Saturday when we help vaccinate 200 janitors. We're gonna capture their testimony on social media. We're gonna get it out, and that's gonna generate a lot more folks to trust that the vaccine is safe, that the vaccine is free, and that regardless of your immigration status, so long as you're an essential worker, you're going to get that vaccine. And I'm so pleased. It's been a difficult process in the last several weeks to get to this stage. We have a lot of work to do, but we're taking steps in the right direction. And San Diego County is again leading in that effort. So I just wanted to share that. So thanks for the opportunity, Chair.
Thank you so much, Christian, and thank you for all of your work and advocacy. So at this point, let me open the floors. If anyone has anything they'd like to share, update their group on, talk about things they need help on, this would be a good time to do it. I've been a little bit shy today. Christian, Dr. Ramers?
Yeah, related to what the other Christian, I just made a comment, by the way, that my grandfather's last name was Ramirez, so we'd be in real trouble if he hadn't changed it when he left Cuba. But to Christian's comment, if I could just actually show one more slide. It was in the back of my deck, but I didn't have time to get it to it. But with respect to essential workers, there's been a little bit of a change from the original scheme to the new plan. And this, I know, was just from down high from the state, but there's a category that really just sort of disappeared, which was phase 1B tier 2, that includes homeless individuals, those living in congregate settings, as well as a large segment of essential workers. And so, Christian, I was curious when you mentioned that, I think it's been a point of confusion for the clinical advisory committee of what to do with these individuals. And I just thought I don't have an answer. I just thought I'd bring it up for what you're seeing on the ground in terms of where these essential workers will be vaccinated. Do they go to the back of the line, or are we including them in phase 1B?
It's a great question, and this has been a point of contention with the state of California. Initially, janitors and security officers and airport workers were included in phase 1B, in tier 1B. When the age process opened up, that's what created all the confusion. We have been promised since about a week ago that the state of California, the Department of Public Health, is going to be updating that list to include janitorial staff, to include airport workers. I did see an update about airport workers about an hour ago, but I have not seen an update about janitorial workers. And this has been the problem. For instance, the County of LA has said, hey, yes, if you're a janitor, we'll get you in. Obviously, if you're a janitor in San Diego County, they'll get a vaccination at Mar Vista later this on Saturday. But other counties, and we have these, particularly folks who may live in Orange County, but work in LA County. Those folks are in limbo because Orange County is saying, no, you're not in. So it's a lot of advocacy work that we're doing up in the state of California. It's been difficult, but I think that we're finally breaking through. And we're going to continue to advocate, particularly for other sectors of essential workers who are not clearly defined in tier 1A and tier 1B. We continue to push for those classifications to be very clearly defined, so that there is no, we don't see situations in which workers who have registered through MyTurn, and as difficult as that is, and in some cases, unfortunately, we have seen those folks be turned away because they have no way of proving that they're, a 1B worker. So that's where we're at right now, Dr. Emerson. That we're hoping that soon the governor is going to help us clear this thing up, so that once more vaccines become available, that we have a place to drive essential workers to, so that they get that essential vaccine.
And Dr. Reimers, we've had to at times just be a little creative, you know, in terms of what we're doing. I mean, it doesn't, I never thought it made sense to say that we were just going to jump to an age-based system below 65 without going through all the tiers of essential workers. And my guess is we're going to get a bunch of folks added to those tiers of essential workers, whether it's the old kind of 1C or we just add things to what we're doing. Would be my guess where we're going to go. I saw the president say it's going to be open to everyone May 1st, and that's great, provided the number and supply of vaccines significantly increases. And then some of them we just made decisions. We started doing homeless and congregate care settings. I mean, some of those it's like we just have to do out of necessity. I really wish after seniors we had just gone right into underlying health conditions. I think if we had done seniors 65 and older and then done all underlying health conditions by zip code, then we could have got a better outcome. But we're going to work through it as best we can, and we're going to open underlying health conditions on Monday. And I think if we target that the good way, then we'll be in a good
Where are
spot.
the additional,
And this is the underlying conditions.
no, where are the conditional categories?
Hey, Dr. Wooten, you're on.
Yes, hi. I just wanted to let everyone know that the California Department of Public Health released some additional categories. Really hot off the press. And it includes janitors and other some of those other essential workers that were originally in 1C that got eliminated and now were added back in. So that starts on March 15th, which is Monday as well. So just want people to know, and also to let you know that those individuals that are that reside in high-risk congregate settings like jails and shelters, we actually started vaccinating the 65 and older when that group began to get vaccinated. And this week we've started vaccinating the homeless population, and the jails are also developing their plan for individuals that are below 65 years of age. So just wanted to let you know that information hot off the press.
All right. Thank you.
Sure.
Thank you, Dr. Wooten. Thank you, Dr. Reimers. Thank you, Dr. Ramirez. Let me open it up.
Not quite.
See if anyone has any final thoughts for us. All right, we will wrap up. Everyone gets 13 minutes of unallocated time to do something very productive and meaningful. Call a friend you have not talked to in a while and something nice, because you all had this booked on your calendar till 6. So you got 13 minutes to do something productive with. Thank you all for all of your work.
Thanks,
And
Nathan.
we will talk to you all soon. Thanks, everyone.
Thank you.